Mindray is one of the leading medical device company worldwide, providing perio-operative total solution to the hospital. This video will focus on the BeneFusion 3 series infusion pump system. Please watch the following instruction guide to learn how to use the pump. For BeneFusion 3 series, Mindray can provide you with VP3 volumetric pump and SP3 syringe pump. The keypad format of VP3 and SP3 are the same. Therefore, the following instructions are applied to both VP3 and SP3 if no special statements. The keys are directional arrows. Clear key will clear data on program and function as a back key. OK key to save or confirm. Start key, start the infusion. Stop key, stop the infusion. Bolus key for programming a bolus or purge. Silence key to silence the alarm. Universal power key for powering on, off, and standby. And menu key for more parameter and program setting. To turn on the pump, please press the power key. The pump will perform a self-test. After pass the system self-test, the pump will enter into the installation instruction interface. Please follow the instruction to load the syringe. Press the handle and pull out the slider to the full scale. Pull down the syringe fixation clamp. Insert the end of the syringe plunger into the gap. Push back the syringe fixation clamp to fix the syringe. Press the handle and gently push the slider back until the sensor touches the syringe. Release the handle to let the clip clamp the syringe plunger. BeneFusion SP3 supports a wide range of syringe size: 5 milliliter, 10 milliliter, 20 milliliter, 30 milliliter, 50 or 60 milliliter. The pump will automatically identify the syringe size. The most commonly used syringe brands have been pre-configured. Please use the up and down arrow to choose the correct brand and size. Press OK to confirm. For the infusion pump BeneFusion VP3, pull out the door latch to open the door. Load the IV set according to this direction. Press and push up the liquid check clip button. Gently straighten the IV set. Load the set into the infusion set slot at both sides. Be sure not to stretch or twist the IV set. Close the door. The most commonly used IV set brands and types have been pre-configured. Please use the up and down arrow to choose the correct brand and type. Press OK to confirm. After correctly load the syringe or IV set, the pump will directly turn into the parameter setting interface. Several infusion modes are provided. The pump will memorize the last infusion mode and parameters before powering off. Normally, rate mode is the default infusion mode. To switch to other infusion mode, press Menu, select Mode, and choose the needed one. The pump has 40 built-in commonly used drug names. Choose the corresponding drug name according to the prescription. This function supports the display of the drug name only. You can contact with the biomedical department or the service partner to switch off this function. Assume the prescription is 15 milliliter per hour as flow rate and 50 milliliter as the volume to be infused. Press OK to enter into the editable interface and use the left and right arrow to select the digit and up and down arrow to adjust the value. Press OK to confirm. The infusion time will be automatically calculated. Now you can start the infusion by pressing the Start key. Assume that you are now setting under the body weight mode. The drug concentration is 10 nanogram per milliliter. Dose rate is 0.1 microgram per kilogram per hour, and the VTBI is 50 milliliter. Use the navigation key to set the value. The infusion time and flow rate will be automatically calculated. Now you can start the infusion by pressing the Start key. The dose rate, flow rate, and drug concentration will display on the screen. The pump supports multiple kinds of dose rate unit. If you need to change the flow rate during the infusion, there is no need to stop the pump. Just press OK. Modify the flow rate and press OK for confirmation. If bolus infusion is required during the infusion, press the bolus key. To enter into the bolus setting interface, the pump supports two methods to give bolus: auto bolus and manual bolus. If the bolus parameter is prescribed, then auto bolus is recommended. For example, set the bolus rate as 800 milliliter per hour, VTBI as 2 milliliter, and press Start to activate the bolus. After finishing the bolus, the pump will automatically turn back to the general running interface with the originally set rate. If you need to switch back to the originally set rate before the bolus VTBI finish, press Clear to turn back. If the bolus rate and amount is not prescribed and need to be determined according to the patient's condition, then manual bolus is recommended. For example, set the bolus rate at 500 milliliter per hour. Press and hold the bolus key to activate the bolus. Release the key when the patient gets better. Then the pump will turn back to the normal running interface with the originally set rate. And there is a beep sound along with bolus infusion for reminding and warning when 0.5 milliliter has been infused. The visualized alarm could help the user to fast locate the trouble. 5 and 4 levels of occlusion detection limits are provided for SP3 and VP3 to choose from. Dynamic pressure system indicates the real-time pressure in the IV set with the pressure number and the pressure progressing bar. For adjusting the occlusion alarm limit, press Menu to adjust. When the occlusion happens, the pressure number will increase and the progress bar will extend with the real pressure in the tube. When the pressure in the tube goes up, the bar will change with the pressure number, being as a pre-alarm to the users. This allows users to deal with the risk in advance and avoid infusion interruption. When the pressure is reaching the limit, the alarm will be triggered. After triggering the alarm, the infusion will be interrupted. The current pressure and the preset occlusion limit will show on the screen. You can adjust it according to the real clinical situation by entering into the main menu. Or locate the occlusion point and then manage the risk according to the indications on the screen. Restart the infusion. The air bubble detection sensor in the pump can detect the air bubble size in 6 levels, from 20 microliter to 800 microliters. You can adjust the level in the main menu. When air bubble is detected, the alarm will be triggered. The pump will display an animatic alarm, indicating the current air bubble detection level, and the guide for eliminating the air bubble or purging to restart the pump. If purge is needed, press the bolus key, set the purge rate, press and hold the bolus key until the air bubble is eliminated. Please notice that do disconnect the infusion set from patient before purge. In clinic, most medical staffs need to record the medicine infusion volume for patients in a certain period of time. According to this scenario, 4 volume collection modes are offered by BeneFusion 3 series, with which medical staffs can easily record down the infusion volume. 4 volume collection modes are 24 hours total, which figures the volume infused in the past 24 hours. Current total, which figures the volume infused within a certain time period to now. Time period, which figures the volume infused in the past certain time period. Timing interval, which figures the volume infused in a certain time interval in the past 24 hours. Once finishing the infusion, the pump will automatically activate the KVO mode. If you want to turn off the KVO, press Stop and change the corresponding disposables, or press OK to continue the KVO. The KVO will be automatically turned off after 30 minutes, which indicates the infusion has been completed. Press and hold the power key until hearing a beep sound. Release the key and the pump will be turned off. If the pump is expected to go standby, press the power key and set the needed standby time. To unload the syringe, take the same procedures as loading. Pull out the slider, pull down the syringe fixation clamp, take out the syringe, load a new syringe, or put all the parts back to the position. For infusion pump, close the roller clamp or Robson clamp. Open the door, press and push up the liquid check clip button, and pull out the infusion set. Install a new infusion set, or close the door. If your VP3 has a drop sensor, please clip it to the upper 1/3 of the drip chamber. Firmly insert the signal line of drop sensor into the drop sensor interface of the pump. Thank you for watching the video. BeneFusion 3 series are the powerful partners for intravenous infusion that are designed with the concept of ease with essential care.